There's Pete. So, Dr. Lonesky, do you Zoom very often?
No, I don't Zoom.
Okay, so this format is how we're setting up IGOT communities for people who especially can't get out and about to get them really connected socially. We can do everything from playing bingo with them to Taylor's going to be talking about the importance of drinking water and your blood pressure tomorrow. Ariel Soller, she's a counselor with me. She's going to be doing an exercise class on Thursday. So we're looking for all kinds of people who want to spend time just with single adults, trying to help them to be happier, to be more physically alert and more mentally alert. Trying to, I guess, help them. If they feel like they're isolating, what we know is if you isolate for 2 weeks, your anxiety and depression goes up, especially if you're elderly. And so I got communities now. We have over 200 members, and the range is anywhere usually from 55 and older.
Sure.
And so we have just different people that come on and talk with us about different health issues that they may have, or exercise, or hobbies. We do some things with hobbies too. So
there's a couple different apps that people use, kind of like doing something like Zoom, which are a little bit different. You may want to check out. There's one called House Party, which younger kids use a lot more, and then another one called Marco Polo that Trudy actually uses a lot with her. Some Christian writers and that she's working with. So they're pretty neat. Different ways of interacting. Because some of those ones you could listen to, like if you talk for a few minutes or wanted to talk about something and everybody can't get on at 6 o'clock, then they can listen to it, then they can record something, and you kind of go back and forth throughout the day whenever you have periods that you can. So it works pretty good.
That is a good idea. Now, this will be a recorded video that we will upload to our website so that people who can't be on it will be able to hear it later.
Okay.
So it will be recorded. Actually, it's recording now. So.
Okay.
And people may pop on. And one thing to understand too is when we're doing this, as they pop on, because they think sometimes they can't pop on until 6 o'clock. So you may be started and then they'll pop on, and you can tell that from time to time they're having problems getting their audio adjusted or being able to hear to speak. So anyway, but it is 6 o'clock, so I'm going to go ahead and let you get started because I don't know how much time you're going to have.
Sure. And we can wait a couple more minutes. I have some time.
Okay.
I don't talk overly too long. Most of the best parts come out from questions, because if one person asks a question, usually there's more than one that has the same question. So, if you want to wait a couple of minutes, that's no problem.
Okay, that sounds good. It's 6 and people are starting to pop on now.
Yeah.
Okay. And so those of you who are popping on, if you don't want to ask questions, then make sure that, but you want to know, make sure you type it in the text box and we'll take your questions actually from there.
Sure.
Also, something about Zoom, the program we have, it's HIPAA compliant. So we're really happy about that, with some of the stuff that we talk about in here.
Yeah. The other ones I talked about earlier, I'm sure are not. So.
Okay. Good to have you tonight, Madeline. And Madeline, we've been talking about, we've got the chat box open and it's at the bottom of your screen, and you should maybe be able to see it from what is up right now, or maybe not. You may have to click on that, but you can also type questions in there if you would like to.
Yeah, and if you hear any noises coming out of the background, that'll be the family. So you never know what you're going to hear.
Was it your dog?
No, I didn't. Not my dog. I didn't hear our dog yet. Probably will, though.
Okay, but you all got a dog.
We do. We have Golden Mini Doodle, I think is what he is. His name is Scout. So it's been fun. Kids enjoy him a lot. He likes to eat a lot of things he's not supposed to, like a sponge, like that you shower with. He likes to go in the shower, grab it, and chew on those for I have no idea why. So it's what he does. We've been through about 4 of them. So
how are you handling being the dog dad?
Oh, it's fine. It's fine. I'm kind of the disciplinarian person of it. So, he listens relatively well to me, and I try to teach him certain things. So it's fine. He usually does the bad things when I'm not around.
Yeah. Also on here, you have the capacity to share a screen if you need to. So at any time, if you're ever speaking, you want to show something, sure. You can show videos, you can show graphs, just all kinds of pictures, all kinds of things as well.
Okay. Sounds good for the future.
Yeah. So Julie, you said they live in northern Illinois. Did they get the snow that came through? Oh, she's going to type. Yeah.
Yeah.
Okay, let's go ahead and get started.
Sure.
Okay.
You want me to just get started then?
Sure.
Okay. Well, I'll kind of introduce myself too. I'm Dr. Timothy Lonesky. I'm a rheumatologist in the Commonwealth of Kentucky. And today what we're going to talk about is arthritis. We'll kind of break down some subjects, but if you have any questions, especially at the end or during this, just feel free to type or ask questions. Really, what we are going to talk about is osteoarthritis. And osteoarthritis is the most common type of arthritis that we have. When somebody says, Uncle Arthur is here today, or my knee hurts because of the weather change, they're generally talking about osteoarthritis. Now, that's different than a lot of other kind of arthritides that we have. The most common one people think about is rheumatoid arthritis. Now, rheumatoid arthritis is when the body has an autoimmune disease, which means that it's attacking itself. And that's a little bit different than osteoarthritis, because osteoarthritis basically is the wear and tear of your joints. If you could see, this is kind of, if you have one bone and another bone together, there's a cushion in between those two, and that cushion is called cartilage. And osteoarthritis is the wearing away or the destruction of that cartilage. As that cartilage kind of wears out, that's when you start to have some symptoms, and you have some common symptoms, which are going to be pain. The number one kind of symptom people have is achiness, or they can also have, especially in the knees, something called crepitus. That means kind of whenever you move your knees, you hear popping and cracking. So aside from that, if you are getting out of a chair and the first 20 steps, you kind of have to loosen up a lot, that's the kind of arthritis that is the most common one that we have, called osteoarthritis. There are some risk factors for people to have osteoarthritis. Number one is age. So this is not something you get when you're 20 or 30. But as we age and get past 50, osteoarthritis eventually will affect all of us. Some people earlier than others. But if you look at people and do x-rays on every American in the US at age 55, about 80% of people are going to have some form of osteoarthritis. Interestingly, women are affected by osteoarthritis more commonly than men. Some people say it's about 2 times as more common. Osteoarthritis can affect you in a number of areas. The most common areas are usually the low back and down, so the hips and the knees. A risk factor for developing, especially those lower extremity complaints like your hips and your knees and low back, is weight. So as you have more weight, it's gravity, and gravity basically is pushing down and causing the wearing out of that cartilage. Some people that have certain occupations, this can wear out their joints quicker. For example, in my office, we call it plumber or electrician shoulders. A lot of people will wear out their shoulders earlier doing certain occupations. If you work in a factory, you tend to have osteoarthritis in the hands a little more early. And also, aside from occupations, you look at things like injuries. So if you had an injury like an ACL tear in your knee, your probability of having osteoarthritis in that knee is increased dramatically. And that goes along with, the old football injuries or soccer injuries. Anytime you've played sports, especially traumatic sports, and had an injury there, then those are things that are going to cause you to have osteoarthritis, especially at an earlier time. When we talk about some of those symptoms again of osteoarthritis, one that I kind of left out is sometimes you can get a swollen joint. The most common joint that will swell is generally going to be your knee. This can occur for really any time, but one of the signs of osteoarthritis can be some swelling of the joint. One thing you can notice when it comes to some of the signs of osteoarthritis too, aside from the pain, is the changing of the joints. Whenever you have those 2 joints that come together and that cartilage is being worn out, what happens is that as there's pressure on your bone, your body's natural response is actually to build more bones around it. You may have heard something called spurs in the back. Spurs are basically that same thing. It's your bones are getting pushed together, and your body's response to try to stabilize those is to build more bone around it. So if you feel around in your knee, sometimes on the inside you'll feel that your knee is more bony than it used to be. Or in your hands, there's certain digits that are important, like osteoarthritis affects you in these digits called the PIPs, and these ones. So if those are big and large and bony, that's the same thing where the bones are coming together and you're having some bony overgrowth due to the loss of cartilage. Now, when it comes to the diagnosis of osteoarthritis, really some things that can be helpful. And really these deal about radiological studies and the physical exam. Physical exam really is the biggest thing. So if you take somebody's history, they're over the age of 50, and they're having some changes like that crepitus, that creaking in the joint, or the gelling phenomenon, which is whenever you get up from sitting to standing, and it takes some time to loosen up. That in and of itself can help you with the diagnosis of osteoarthritis. Then you can look at the radiological studies. Really, this is looking at x-rays. X-rays help you really a lot of times determine how much cartilage is lost. But interestingly, some people, they will have a significant amount of cartilage loss, and have minimum symptoms. And other people have mild cartilage loss and they have a lot of symptoms. Now, we don't really fully understand why this is. There are some thoughts that perhaps some people have a lot more bone marrow edema. That basically means where those joints are coming together, there's some swelling inside the bone surrounding it, and that can cause pain. And some people that happens to more often than others. So just some, a thought as to why some people have more pain than others. But aside from those, really those are the two ways that we look at osteoarthritis. When you look at labs, unlike some diseases like rheumatoid arthritis or lupus, where labs can be very, very helpful, osteoarthritis, there are no blood tests that tell you you have osteoarthritis. Now, in the future, we're coming up with a couple newer ones, and there are some in the literature that us as rheumatologists, we know about, but those aren't commercially available yet. So right now, the treatment or the diagnosis of osteoarthritis is based on your signs and symptoms, physical exam, and usually x-rays and potentially MRIs if needed. Now, when it comes to the course of osteoarthritis or the breakdown of the joints, really this is something that slowly worsens over the course of time. You can have intermittent pain, which is, I do pretty well, but then every once in a while, boy, my knee or my shoulder or my ankle really bothers me for a couple days, and then it goes away. Other people, they have pain constantly with it. So really, there's a lot of variance as the course of people's osteoarthritis. And to be quite honest, really what it comes down to when it comes to the treatment that your doctors do, your doctors cannot cure osteoarthritis in 2020 with medicines. What they do are give you medicines that try to help your symptoms, and that is it. At the end, if a joint is worn out enough and your body allows you medically, and you have enough symptoms, the end result of osteoarthritis in certain joints, especially the hip and the knee, is replacements. Obviously, that's not something you want to get into, and you want to try to help the symptoms as much as possible. But, towards the end, that is when you're having things like hip and knee replacements. When it comes to what can I do to help osteoarthritis before needing surgery or other things like medicines that your doctors talk about, really what you're talking about are a couple things. Number one is when it hurts, you really should rest it some. Most people, you have to have a good balance of this though, because if you rest it too much, then you're not doing enough. But if you have walked all day and you're going for some Christmas shopping and you're not used to it and your knee bothers you, well, generally you shouldn't be doing cleaning that night, and you really should be resting it. Some of the things you could do are what we call RICE, right? Rest, ice, 20 minutes on, 20 minutes off. Compression. Some people wear compression sleeves on their knees, on the elbows, and then we have elevation. So whenever you are icing an area, you want to try to have that area above your heart. So those are some simple things that you don't need a doctor to help you with, to help some of the symptoms of osteoarthritis. Some other things that are helpful are obviously physical activity. Some people say, well, I have arthritis in my knees and hips. Should I walk or should I just not do any exercise? The answer is to build up your activity for a number of reasons. Number one, it will not destroy your joints worse than resting. Number two is that exercise creates so many other benefits to your health, including increasing your hormone levels, helping your heart, helping your mental function significantly. Some people can require certain exercises or physical therapy, especially if you have specific joints that are bothering you. You can use certain things. such as splints, canes, walkers. Really, and especially, if you have osteoarthritis and you're over the age of 80, really the biggest thing you need to worry about, aside from the symptoms, is falling. So if you have significant osteoarthritis in the lower extremities, what we try to do is reduce the risk of falls, because if you're 80 years old and you fall and fracture your hip, the mortality, which means you're not going to be here on planet Earth in about 1 year, is about 50%. So a fracture at the age of 80 is something we want to prevent. So that's really where canes or walkers can be very helpful. And really, those are some of the things that you can do to try to help with osteoarthritis. Some people ask about vitamins or herbs or supplements to try to help this. Overall, and this is a multi-billion-dollar industry, overall, the supplementation process has been very disappointing. There have been multiple studies by the NIH for something that's very common called glucosamine and chondroitin. The vast majority of these studies reveal that it is not helpful in osteoarthritis. Now, it also has very limited toxicity. So some people will come up and say, hey, I've tried this medicine, it helps, fine. Its probability of interacting with your your other drugs, is very low. And if you get a very good effect, that's perfectly fine. Remember, the placebo effect in osteoarthritis is about 30%, which basically means, most people that when you're taking a supplement or a different something as an alternative, it can really help people because they're concentrating also on the fact that they have osteoarthritis, and perhaps they're not getting up that ladder that they know that they shouldn't be getting up, or walking those extra miles that they potentially know would be hurting them because it's a little bit further than their norms. Otherwise, in 2020, the other supplement that is common right now is turmeric, which is a root. And there's actually some decent data that this can be helpful. So that's something that you can talk to your doctor about, as something to potentially go on for a period of time and help. But aside from that, really, there's not a large amount of data to support other supplements at this time. So really, aside from that, I've talked for about 15 minutes, and I wanted to make sure I had some time and some questions and things like that about osteoarthritis. So I guess at this point, that's kind of my talk, and we can take questions, or I can answer anything you'd like me to. Sound like a plan? Okay.
So I think
CBD oil. There we go. How could I forget CBD oil? Okay. So CBD oil. CBD oil. I'm gonna talk about this in a number of ways. Number one, if you look at its drug interactions, it's limited. There are some drugs that CBD oil can interact with. So you do want to tell your doctor if you're on these medicines, okay? Especially if you take other drugs. CBD oil in 2019 and 20 is the new boy on the block. It is the one that has a lot of press or Facebook posts and things like that. There is some data that, yeah, I think CBD oil can be helpful. Do I think it will work for everybody? Absolutely not. But to me, in 2020, until there's a reason to nod, based on the data I have, I think it's very reasonable to try CBD oil. Sure. Really what you want to do is give yourself a trial, whether that means you try it for 1 to 3 months. And if it's not effective and you really want to judge it, you want to write down your pain scores and how you feel with it. And as long as you're not on any drugs that interact with it, or it's not causing significant side effects, I think it's a reasonable thing to go on, or at least to try. So I'm not, some people say, well, Dr. Lonesky, you just want the drugs to work and you don't want any alternative medicines. And that's not true. I actually would love alternative medicines to help. It's just, you really want to look at them from a data management standpoint. So I don't go out and say, hey, everybody, if you have osteoarthritis, be on CBD oil. There's not enough data for me to do that. But if a patient asks me, hey, what are your thoughts on it? Really from as much data as we have, it's generally tolerated well. Its drug interactions are low. And I think it's worth the opportunity to try, especially because some people can't take some of the medicines that we classically use for osteoarthritis, being anti-inflammatory medicines.
How do you see it being used most often? Topical, or are they using the liquid and dropping
Most
it?
people are using the liquid forms or that under the tongue. From a topical standpoint, that actually brings up something else. If you look at pain, so let's say my knee hurts. Your body is built so that if this is pain and I have my pain receptors that are stimulated, if I stimulate other receptors, like ones that work for vibration or ones that work for different chemicals, if I stimulate different receptors at an area that's in pain, your body's only set up to have so many nerves firing at once. So the pain actually comes down. That's why things like, you're putting menthol or there's a classic one people use around here with horses, E-Blue or I forget what they call it. So any of these ones that are topical, even lidocaine, all these ones that work a little bit different, that's how they tend to work. There are some other topical ones. There's an anti-inflammatory one you can use. That's a prescription-based one here in the U.S. But again, if you're stimulating different nerves in a different pathway, generally you reduce the pain. Overall, if you do something topically, you reduce the amount of side effects dramatically. One thing that we use, like if I take an oral anti-inflammatory medicine, the vast majority of it is absorbed systemically, which means it's going throughout your entire body. If you use the one that is used called diclofenac gel, if you put that on your knee, it only gets absorbed about 5%. So if you can get away with anything that you can do topically and it helps you, your probability of having side effects systemically go down dramatically. So if it works topically, great. Do I have enough data that says, topical works better than oral? I don't.
I have a question. So you talked about osteoarthritis and rheumatoid arthritis and replacements to joints.
Yes.
Do people with, so you can have both at the same time. You can have
Yes.
osteo and rheumatoid. Is it likely that people with rheumatoid will have to have joint replacements?
Yes, because they destroy their joints much more aggressively than osteoarthritis. And the worse that their rheumatoid arthritis is controlled, the more inflammation and destruction of those joints that happens, then the more likely they're going to need joint replacements, and multiple ones at an earlier age. So if you want to protect your joints and not require joint replacement surgery, if you're a rheumatoid arthritis patient, you want to be very active and aggressive in treating your rheumatoid arthritis.
Yeah. What about nutrition as far as foods that can make arthritis worse, or foods that you know of that make arthritis better? Can you
Sure. So this is an area that is getting more and more research. So for me, what do I, from all the data I look at, if you look at something called your gut microbiome, or your bacteria that are in your gut, if you look at people that have bad rheumatoid arthritis, their gut, or or the trillions of bacteria that are in their gut look different than people that do not have rheumatoid arthritis. And it also looks different than people that have better rheumatoid arthritis. So the thought process is, the healthier my gut is, the better my diseases are. Now, we have not proven, and nobody's done a situation where they've changed people's bacteria in their gut in humans, and it has changed their arthritis. They haven't done that trial yet. And that would basically be what's called a fecal transplant trial. They have done this in rats for many diseases. For example, if you want to hear something crazy, if you take a rat that has diabetes and they, or a mouse, I'm sorry, I'm saying rat. If you take a mouse and you genetically give it diabetes, if you change its bacteria in its gut, or you do a fecal transplant with a mouse that is normal, so I take the mouse's poop that's normal, and I give it to the mouse that has diabetes, and I take the diabetic mouse and I give its poop to the well mouse. What happens is the well mouse now develops diabetes, and the mouse that had diabetes does not develop, or their diabetes goes away. So this is kind of one of the early trials that they looked at, which really astounded scientists. So that kind of got the ball rolling in when it comes to this gut health. Now, when it comes to diets and can I control my arthritis based on my gut? I don't have a great New England Journal of Medicine trial that I can give you that says, here, this points to it. There's a lot of small ones, but I'll give you what's happened to me in my experience over 15 years of doing rheumatology, and this is it. If you have a healthy gut, which basically means the more clean eating you do, getting rid of processed foods and high sugar content, high fructose corn syrup and table sugar. And whenever you eat something and you look at the box and you can't pronounce the words that are in it, if you get rid of doing those processed foods, something that is called clean eating, the patients that I have that do this require many, many, many less medicines than people that don't do it. Some people, they're able to do it well enough that they don't need medicines. But generally, what happens is people that have really bad disease, if they do this clean eating, they require a lot less medicines and have a lot less inflammation than those that don't do that.
Okay.
Now, that's much more common, and it helps a lot more in autoimmune diseases such as rheumatoid arthritis, psoriatic arthritis, lupus, than it is in osteoarthritis. But most people, this is what you do. You clean eat for 3 months, you're going to feel so much better, and your joints aren't going to hurt as bad, I'm going to tell you.
Okay. I've got to run grab a pamphlet really quick, so keep talking for 2 minutes.
Okay.
So I have another question about
Yes,
osteo. So have you seen a trend with the age group that sits in the office all day, is looking at a computer all day? Have you seen a trend with osteo in the lower hip, but not even that, like in the tailbone area?
Yeah. So what it is what we've discovered is sitting all day lowers your life expectancy. You will develop osteoarthritis more commonly in the lumbar spine, in the hips. The SI joints is usually what you're talking about when you're talking about like the lower spine. It is up significantly. In fact, it was enough that when I'm in my office, I don't sit in a chair. In 2 of my offices, I stand all day. And the other office, I have one of the like a bouncy ball type of thing that sits on wheels, and that actually makes me position myself and have to use my core and straighten my back. So, because otherwise I'm going to fall over. I've done that so long that when I actually sit in a chair, like right now I do, at the end of it, if I'm in it for 20 or 30 minutes, my back's killing me. So we have seen two things. Number one, arthritis does increase. Number two is you put on more weight and you also get less strength. So the longer we are in chairs, it's detrimental for a lot of different issues, including degenerative disc disease or osteoarthritis. Yeah.
Yeah. And I can attest to that because I've been sitting now for 10 years doing counseling, and I can't see how I can do it. I sit on a bouncy ball, but.
Yeah, well, if you come in my office in Somerset, you'll see them.
Okay.
So I highly, if you're looking at changing what you do, you have to think about your work every day. And if you are somebody that works and you're at a desk or at a certain position, number one, get up as much as you can, even for a 5-minute walk. Lunchtime should be a walking time. If you have an hour, you should eat for 10 or 15 minutes and then get a group of people and walk around. If you're able to stand and have a desk that you can stand at, that's better for you. If you have a situation where you can get one of the what do they call it? The walkable treadmills. They make some online. That is a great investment for yourself. In fact, when you think about the investment compared to the medicines and pain you're going to have, they're great investments. Hopefully you can get your employer to do it, but even if they don't, get it an okay and try to do those type of things that you can yourself. But at minimum, walk around before you go into work. Come 10 or 15 minutes early. Walk around during lunch, and then walk around for 10 or 15 more minutes before you get in your car and go home.
Yeah. Okay. Now, one of the things about IGOT communities is we try to calm the fears of the aging. So here's something that I saw today, and I'm 63, and I'm thinking, okay, now this is a little confusing. I need to talk to somebody who understands. So it's in today's paper. It's a full page. It's a full page article on, it's called Health Exchange, Kentucky Center for Regenerative Medicine.
Okay, yeah.
And it's talking about
that's not an article. That's not an article. That's an ad.
It's an ad. And it's
so if you see anything like that, there's two different types of things. These are advertisements, and I'll tell you about them. One of them that you'll see is for knee injections, called viscose supplements or hyaluronic acid injections. These are FDA approved, and you can do injections into the knees. What it is basically you're giving the lubricant that you have in your knees, and you're injecting them back into the knees to help with pain. They do not cure the knees, they help with pain. So I actually do use these, and they are helpful for people. So it's a good way to help the knee pain where you don't want to take a pill or a supplement to try to give it some effect. So, but there are some people that know that this is, they do it for different reasons. And a lot of the times you have to be careful who's giving you those injections from a profit standpoint as compared to helping patients standpoint, okay? Number two is regenerative medicine. Now, this gets into what does the future of medicine look like? Regenerative medicine, really there are some great thoughts, some good data on regenerative medicine, but in 2020, we are not there. Stem cell injections or regenerative medicine that they have are not FDA approved. And some people will get injections of embryonic stem cells and these other ones. There isn't enough data that justifies the cost. You're looking at spending, a couple $1,000s to get an injection of something that really, I want to work. I think there's some good data for it. If you look at something called meningeal cells. These things help grow cells into repopulate cells. The problem in the joints is the cartilage cells are buried deep into the cartilage, and there's not a lot of growth that can happen there. So some interesting things that are going on. Some people are actually formulating some signals that you'll be able to inject into the knees or the hips in the future, where it actually causes the cells that are there to produce more cartilage. That's coming out in the next couple of years. That's real. And then there's some other people that you'll be injecting scaffolding, so that there's more area for the cells to grow more cartilage. Those are really the two big areas that we're looking at. I think regenerative medicine has a lot of promise. It's just right now, it's not something that you can recommend to patients, to be quite honest with you. You'll see a lot of pro athletes do it, and they've gone to other countries or this country. Now, in saying that, there is something called PRP, which is plasma-rich, platelet-rich plasma. There have been good trials on this, but the best trial has been in tendons. And the most common one that they did in Australia was one where they give injection here called tennis elbow. So this is one that it works very well for. And basically what it is they take your blood, they spin it down, and they get some nutrients and inject it back into you. Well, it's your own blood, so you're not going to react to it. And what they showed is it worked as well, if not even a little better than doing a steroid injection into that area. But it appears that PRP is more useful for tendon injections as compared to osteoarthritis, where there's cartilage damage, at least at this point in 2020.
Okay, so when you are a senior adult and you run across things, it's just like, all kinds of, a lot of people have a lot of things geared towards senior adults.
Of course.
What is the best way for IGOT communities to help them, and what is the best way for them to make very intelligent decisions about their health at their age? Because it gets very confusing.
So you have to understand that most things that you see on Facebook or you see in the newspaper are going to be advertisements. They are advertisements and this is really why. Osteoarthritis hurts. Your doctor cannot cure osteoarthritis, and there's a huge industry associated with it that tries to help you. So you just have to be very careful with what you read. Now, the best thing that happens is you grab something that catches your mind and you say, hey, I think this could be helpful. And then take that article or that Facebook, take a picture of it, or bring the newspaper into your doctor's office and then discuss it. I honestly, that's the best thing. So I don't mind, like I said, I'm not against certain things, but you are targeted very heavily, and you have to understand that because you have some people that have expensive or disposable income, and you're trying to avoid certain surgeries and things like that, and that's where it comes into play.
Okay. Any other questions?
Did that sound okay?
Yes.
Yeah, you have to be careful. It's like people that call you on the phone nowadays, all the robocalls, it's always somebody trying to, yes, Miss Taylor, it's usually somebody trying to get your money.
Okay. All right. Any more questions before we end up?
There's a question in the chat about Tylenol, arthritis strength, and daily and every other day,
Sure.
weekly.
Yeah, when it comes to medicines that you use, generally, now we're talking about non-supplements right now. You can hear my kids in the background. Tylenol. So there's the safest one that we give is Tylenol arthritis. And in general, you can take 2 extra strength Tylenol or Tylenol arthritis up to 3 times a day very safely. Now, the problem people get into is when they take Tylenol 3 times a day routinely. If you are doing that, let's say most days of the week or every day of the week, you really should be followed by a doctor. And the reason is that they need to check certain blood work. And it's not blood work that you have to do all the time. It's usually every 6 months that you check your liver and your kidney function. At those doses, you really don't run into problems until you've been taking those kind of doses for many years. And that's usually the case when it comes to anti-inflammatory medicines. You're usually not in trouble at the early onset. It's usually when you've been taking them for many years that people get into problems. Now, the older you are, when it comes to like medicines like ibuprofen and Aleve, the older you are, the more risky the medicines are. And the 3 biggest risk factors you worry about are, number 1, if you have stents in your heart or you've had a heart attack, you should not take those medicines. Number 2 is they can affect your kidney, especially the older you get, the more they can affect your kidney. Liver, a little bit less. And then number 3 is ulcers in the stomach. You have an increased risk of ulcers in the stomach over the age of 65 when you take anti-inflammatory medicines routinely. That means once a day, taking them daily. So, the safest one out of anything that your doctor can give you is going to be Tylenol extra strength or Tylenol arthritis. After that, then you're looking at things over the counter that are like Motrin and Aleve. And then after that, you're looking at the medicines that your doctor can prescribe to you.
Okay.
Did I answer that? Sound good?
All right. Any other questions? All right. Well, thanks so much for being on.
Sure.
And we would love for you to come back from time to time and talk about some of the other arthritises and lupus and different things. Anyway.
Ask me anytime. I'll come back. And one of the best things for me is I love asking or answering questions. So, if you want to do one of these and just say, hey, people, come with some questions that you have for whichever topic it is. I won't talk as much next time, and we'll go over questions.
Okay, sounds good. Thanks everybody for joining us. And so all I have to do is make a little click. And Karen, I'm not sure if you can hear me. I'm not sure. But anyway, it's time to end the meeting. But thanks so much for participating. And there's Karen. Oh, this is late. I'm sorry. Karen, we have a chat box open. Would you like to type a question into the chat box? Okay. All right. Just to the group. This has been recorded, so we'll get it up and running, and people can come back and have access to it as much as they want to. Be sure that when you're talking with other friends, to let them know about IGOT communities and the Zoom meetings. And thanks, Dr. Lonesky. You want to give them your locations in case somebody needs to come to a doctor.
Sure. We have a few locations in Kentucky and southern Indiana. So the easiest way is just going on InsideLCR.com, or you can always call our number. The main office is 606-802-2300. And we take people anytime. You don't have to get a referral. We found that if you have some questions that need to be answered, as long as your insurance says it's okay, we'll see you anytime.
I know some of these people are from the London area. You are in the London office?
Yep, we have offices in London, Somerset, Danville, and New Albany, Indiana.
Okay. All right. Okay. Thanks. I'm going to go down here and I'll click in the meeting, but thanks for joining, and we'll talk with you later.
All right. Take care.